Today we have Dr. Michael Moore, a director of Medical Science Liaison at Pfizer's migraine team here with us. He'll share some tips on what pharma wants in terms of resume and interviewing. And then we'll go into a bit of Q&A from the questions that you guys submitted ahead of time. I'll let you take it away, Dr. Moore.
Thanks, Kathy. How's it going, Northeastern IPhO? Thanks for hopping on this. Thanks for spending the time. So as Kathy mentioned, my name's Mike, and my whole job today is I just want to give you some good insight from an insider's perspective of what pharma is looking for when it comes specifically to resume and interviewing tips. I'm going to admit this isn't the most fun topic. It's not the most engaging. It's, some of these things I'm going to be going over are going to, on the surface, appear pretty mundane, but I can tell you it is absolutely vital, the things we're going to be talking about, and then saving some time for some of your questions and going through some answers at the end of this. So without further ado, and also I'm pretty easygoing, so if you'd like, you can always hop off mute. You can always say hello. You can always interrupt me. I have a tendency to monologue. It's one of my flaws. So if you're on a slide and there's something you want to ask just right in the conversation, just hop off mute, interrupt me, ask your question, and we can get engaged in a dialogue. So don't be scared. Don't be shy. This is just a legal disclaimer. I'm here. These are my views. They don't represent the views of my employer, which is Pfizer. And so, yeah, all the stuff that we're going to be talking about, these are just my opinions. That's all they are. So how did I get to pharma? I'm not going to spend too much time on this, even though this story was something. It's just crazy looking at this timeline and thinking about how fast all this went. So I grew up in Pennsylvania, went to a small school there at Gannon University, wanted to go to med school. Then when I got to my senior year, had kind of a second guessing of whether that's actually the right career path. I wanted a lot of quality of life whenever I was an adult. I really enjoyed my free time. So I decided to go for a PhD. I go to Texas A&M, get my PhD in biochemistry in August of 2017. And then this is that 2017 to 2018 jump. That was, I'm going to be real with y'all, that was my lowest point in life, because for 6 months from August 2017 to February 2018, I put my chips all into the center of the table, and I went full steam ahead on trying to get a medical science liaison position in pharma. It was risky because I was unemployed for those 6 months. I had no job, no prospects, and I was just all in, like I said, on trying to get the MSL job. And what I did over that 6 months is I networked every single day, talking to MSLs, learning from them. And then eventually in 2018, Otsuka Pharmaceutical gave me my first chance, changed my life. I love that company. I love those people. I still keep in touch with them. And so, yeah, then my career goes from Otsuka to a small pharmaceutical company called Pharma. And then I ended up at Biohaven Pharmaceuticals in 2021. And then something big happened. It was a first for me. Biohaven's migraine franchise got acquired by Pfizer. And so now I'm an employee at Pfizer. Small little company. You may have heard of them, but that's my story. It's crazy just looking at that and thinking about everything, but let's get to the good stuff. All right. So I have to give you this. I have to level set. When we are going over this resume and interviewing tips, it's important for you to understand where I'm getting this information from. And so that's where the sources come into play. What I'm about to share with you is coming from not only personal experience, but it's also coming from one-on-one discussions that I've had with recruiters who are, trying to get medical science liaisons and fill positions for pharmaceutical companies. It's coming from senior colleagues who've been in the job for a very long time, sometimes decades. And then it's also coming from hiring managers and executives who I've talked to over the course of my 5-year career. And I'm always trying to learn from these people. And so it's coming from that. It's coming from also the fact that I do take mentorship seriously. And so I get a lot of people reaching out who want to transition into the medical science liaison role. I wouldn't have gotten my first gig if it wasn't for people taking the time to educate me, to answer all my questions, to be a support system. And so I pay it forward. And so I've mentored a lot of candidates who have been interested in transitioning to industry, helping them on the resume, helping them on the job interview. And boy, oh boy, there's a lot that goes into that. Then lastly, I've been in the shoes of both the interviewer. I've worked at 4 different companies, interviewed with 3 of them, but I've done a lot more interviews on the side. And then also I've been a part of being someone who's interviewing potential candidates. Now, the big caveats in all of this is that everything I'm going to share with you, for the most part, there's going to be high levels of case-by-case variability. You're all different. We're all unique. And so because of that, I'm going to be giving you sort of broad general tips. There's also the caveat of that these positions in pharma are competitive. These fellowships in pharma are competitive. You're getting PharmDs applying to these, PhDs, nerds like myself, MDs and DOs and NPs and PAs, people from clinical backgrounds who are coming into these pharma positions. So it's going to be competitive. And so one of the other biggest caveats is that there's going to be some luck. And with this stuff, the things I'm going to be sharing with you, these aren't etched in some stone tablet. Some of these things are going to be a gray area. So I want to give you that up front. Now, I was watching The Hot Ones. It's a show with hot questions and even hotter wings. And I was watching the one with Bryan Cranston, and this quote of his came up in the interview. And as I was watching it at my home, I said, wow, this quote is the perfect theme that really encapsulates the resume and interview process. And that is, you're going to do everything you can when you're working on your resume and when you're interviewing. You're going to do everything you can to put yourself in the best possible spotlight, the best possible position. You're going to control all the factors and aspects of the process that you can control. But at the end of the day, you may not get the job, even if you did everything right, even if you were the most prepared, even if you had a great personality that resonated with the hiring manager and the interviewers. You need to know that up front. I don't want this to be a pessimistic sort of outlook on the whole process. But if we think about a glass that's half full of water and half empty, I want you to at least acknowledge that you can look at that glass as half full, but I want you to also acknowledge that it is also half empty. So you can still be optimistic about all this, but you also have to be realistic. And everything I'm going to share with you is things that are going to try to put you in the best possible position. It's going to be trying to stack the odds in your favor. But at the end of the day, it's going to come down to luck sometimes of whether you applied at the right time, of whether you got the right hiring manager who was open to bringing someone who has no prior pharma experience. All of these things are things you can't control. Okay, enough jibber jabbering. Again, feel free to interrupt if you have questions on any of the stuff I'm about to go through. Tip number 1, when we're focusing on the resume, what I've done here is I'm bearing my soul with you guys, okay? And I'm bearing my soul because I dug through the archives and I found the resume I submitted for my first MSL position at Otsuka. So that's there on the left, and I juxtaposed it with the job description that was available at the time. And so the first tip is when you are working on your resume, number 1 thing is you're going to use that job description as your blueprint, as your roadmap, and you're going to tailor and mirror the language, the verbiage, the phrases, the buzzwords, and you're going to mirror it off of the job description. And you're going to then try to apply that with how you word things on your resume. Of course, you're not fabricating anything. You're not making anything up. But if you're seeing things on that job description where you can make a claim or you can write a bulleted item on your resume, you're going to do it in a way that mirrors the language that's used on that job description. Think of the job description as answers to the test, or it's kind of like the pharmaceutical company's dating profile. And that job description, that dating profile, they are broadcasting who they are looking for. So if the pharmaceutical company is broadcasting on their job description that they're looking for somebody who loves the outdoors, loves walking around in nature and going on hikes, and loves long walks on the beach, and you're somebody who loves playing video games and never leaves the home, it's not going to be a good match. And it's going to be reflected on when you look at your resume and whether it matches up well with that job description. And I'm bearing my soul because if you look at my resume here, it's pitiful. It's honestly pathetic. My resume is, when I applied in 2018 for that MSL role, it's pretty awful. But I did the best that I could. I controlled everything I could. I got feedback on it. And so I'm showing you there in the red, the mirroring and the matching of words and terms that I was trying to get reflected on my resume. So that's tip number one. Tip number two, your resume it doesn't quite jump off the page. It's not as dynamic. It's a list of your experiences. You have to be concise and succinct with how you word things. LinkedIn, leverage the fact that we have LinkedIn. And you want to believe that LinkedIn is your friend. This is your ally. And the reason for that is because many folks in pharma love them some LinkedIn. And there's things that LinkedIn can do that can complement, but also amplify how you are viewed on your resume. So what do? You really fine tune and polish your LinkedIn profile. Think of this as your personal digital brand. It's just like if we were in person and I shake your hand and we're talking, we have a first impression. You can't do that in the digital world. So what do? You have your LinkedIn profile. Get a nice, fancy, high quality professional headshot. Dress professionally for it, smile, really think about what message you're conveying through your LinkedIn profile. And again, think of this as your personal brand. And what you're going to do is you're going to polish this LinkedIn profile up. You're going to tailor all the content for the specific role, fellowship, internship, whatever. You're going to tailor it to that so that everything on your LinkedIn complements what you're doing on your resume, which should be tailored for the role. And then what you're going to do is in your header, you're going to include your personalized LinkedIn URL along with your contact information. So up there in the header where you have your cell phone number, your city and state, your email address, you're also going to put your LinkedIn URL. And as a fun bonus fact, you can customize your LinkedIn URL. So I'm giving you mine right here and kind of showing you the thought process. You can see on my profile, I'm listed as Michael J. Moore, PhD. There's a lot of Michael Moores, and also shout out to Michael J. Fox, Marty McFly, Back to the Future. So I do Michael J. Moore, PhD. And then what I do with my URL is I also customize it so that it aligns with that. And then what happens with my email address? My email address is michaeljmoorephd@gmail.com. So all of these things are consistent. It's reinforcing my brand. And then I'm including that on my resume. And LinkedIn is great because you can share more diverse, dynamic content. You can share photos. You can share videos. If you've gotten a media spotlight, you can share that. You can share recommendations. And so all of this stuff is supplemental. And I guarantee you, when you're applying for this stuff, they're going to be looking up your LinkedIn anyways. The recruiters, hiring managers, when they see your resume, they're going to hop on LinkedIn and just see if you're on there. So you might as well polish that baby up and be on the offensive rather than the defensive. Put it on there. You've already controlled it. So that's enough LinkedIn talk. Resume tip number 3. This is kind of nuts and bolts stuff. And this is coming from the fact that I look at so many resumes for people and give them feedback. And this is by far one of the most common feedbacks that I give. So when you're looking at divvying up your resume in sections and then also included bulleted items to elaborate on your experiences that you're including in the resume, the number one tip that or the number one feedback and input that I have to give, typically when it comes to the sections and the bulleted items, is that, again, with the bulleted items, you should be trying to mirror or match the wording in the job description. Use the same keywords, phrases, as long as you can back up that they actually matched what you were doing in whatever experience you had. And then the other thing is, when you have your bulleted items, you want to list them, those bulleted items, in order of most relevant to the position that you're applying for. And you want that bulleted item to be at the top. And at the top is the most relevant and most transferable. And then when you're listing those bulleted items, the one that's at the bottom is the least relevant. Now, here's the kicker. All of your bulleted items should be relevant to the position that you're applying for, the position that you're seeking. So all of the things should be relevant. It's going to be an exercise to you. How well do you know the position that you're applying to? And if you know the position well, and you know it inside and out because you've talked with a lot of people and you have that experience, what you'll find is that you'll be able to prioritize, because you know the role so well, you know the fellowship position so well, that you'll know what experiences, what soft skills are most important to that position. So you rank them from top to bottom, top being the most relevant bulleted item, bottom being the least relevant. In terms of sections, I just included here what sections I would highlight if, and these are sections that I have in my current resume. So you as pharmacists are different than little old me PhD biochemist, because y'all are going to be able to have clinical experience. That is huge for pharma positions. Remember, pharma is at the interface between manufacturing therapies, medications, devices, and the healthcare community. So pharma is always looking for people who have had experience interacting with the healthcare community, within the healthcare community. It's something that makes y'all special. And it's something that PhDs, unless we got some special experience that we really, dug and clawed for, we just don't have that. So definitely emphasize on your resume, have a section on clinical experience or therapeutic area experience. The big section that I would recommend leaving off, and again, these are just opinions, but a lot of people's resumes that I get, I see they have included a skills section. And under that skills section, all they're doing are they're not elaborating. They're just writing like communication skills, presentation skills, stuff like that. And so I would recommend deleting that section. And my opinion and rationale is because if you're writing a good resume, those skills should be clearly evident when you're looking through all the different experiences you have and all the bulleted items that you're including to back up and bolster those experiences. So I would recommend just taking away the skills section and just emphasizing them, making them clearly evident in the actual resume in your experiences. All right. This is an important tip. You're not going to get away from this. This is going to be something that it's available to you. It's controllable. You really can do something in this realm, and that is you can network. Again, this is all predicated on step number 2 or tip number 2, where you've already taken the time to polish up your LinkedIn profile. And then you're going to leverage that LinkedIn profile. It's going to be a tool, just like a hammer. And you're going to get on LinkedIn and you're going to say, hey, there's some pharmaceutical, roles and positions that I'm interested in. Maybe I need to connect with people who are in those roles. And so you're going to have your polished LinkedIn profile. You're going to search up people who are in those exact roles. And then you're going to send them a cold message. There's no way around this. They have information that could help you. And it's up to you to be proactive, to show initiative, to be hungry and driven for this. And you're going to reach out to these strangers who are in the same role that you're seeking. And you're just going to introduce yourself. You're going to be professional. You're going to keep it concise, and you're going to ask and request for a small amount of time to hop on a phone call or a video conference call. And not everybody's going to answer you. And that's okay. If you send out, whenever I was unemployed for those 6 months in my lowest, subterranean sort of emotional state, I was reaching out to people nonstop on LinkedIn, and not everybody would answer me. But the ones that I found who did answer me, out of that population, I found true mentors, lifelong mentors. And so that is going to be what you're going to do, because when it's going to help you on your resume, you're going to build these relationships with people through networking who are in the same positions that you are seeking. You're going to pick their brain about what it's like to be in the role. And then if you really feel good connection with them, this is going to be a test, sort of a litmus test of how good your emotional intelligence is. Based on your interaction with these people, this networking, this connecting with people and picking their brain, if you feel like this person is somebody who understands you, who has your best interest at heart, and you really feel like the relationship, this person, you're able to resonate with this person, that they're your people. If you feel that way, then you're going to ask them if they'd be open to sharing their resume with you. And you're going to be able to see a blueprint of what experiences they're emphasizing in the role that you're seeking. And if you really feel like the relationship has some, meat and some real substance to it, then if it feels right, ask these people that you're connecting with, ask them if they'd be cool with checking out your resume and giving you honest, genuine, direct feedback on ways that are gaps that you have on your resume or things you can do to optimize it. Network is going to be one of the biggest pieces of advice for resume. And as a spoiler alert, it's going to be a big tip when it comes to the interviewing stage. Okay, so with that, let's wrap this up. With resume, I get a lot of questions about length. Keep it, 2 to 3 pages at max. And anything beyond that, then you're starting to go into the CV sort of arena. Think about your executive professional summary. I've included mine here, again, bearing my soul to all of you. So this is going to take about maybe the top 1/3 of your resume. And so think of this as your elevator pitch. It's going to be something that sums up who you are and what makes you a valuable asset, what your value proposition is to the hiring manager who's going to be considering you for the job or for the fellowship or for the internship. So think about it from this point as well. Your executive professional summary is at the top of your resume. It's going to be one of the first things that recruiters and people are going to be viewing. So you really want to craft this, and you want to craft it well. Be able to support everything you include on your resume. Don't fabricate. Don't make anything imaginative up. Don't embellish. Don't do anything fancy or overly artistic and creative. Pharma is not the place or the industry that's really interested in using these kind of out of left field fonts or using distracting sort of designs and structures of resumes. Keep it pretty straightforward. Don't include personal information like, what your hobbies are. Don't include pictures on a resume. Don't include an unprofessional email address. Don't do it. Make sure it's, just reinforce your brand. You're all going to have PharmDs after this. Put PharmD in your email, your first name, last name, PharmD, simple as that. And then last tip for resumes is master action verbs. We tend to put so much emphasis on these flowery, colorful adjectives. But when it comes to resume writing, it is action verbs that are the type of word that you really want to maximize. You don't want to put these mundane sort of verbs to explain what you were doing in the job. You want to find these powerful, impactful action verbs. Go on Google, do a search. There's tons of resources out there on, top tier, top shelf action verbs for writing a resume. All right. We're coming up here on time, so I'm going to speed this up. Interviewing. So you're going to be coming into this with no pharma experience. So I had a talk with a really close mentor of mine, and she was saying that when you're somebody who's coming into the pharma industry and you have zero experience in pharma, the truth is you need to work and research harder than anybody else. You need to double, triple the amount of work and effort you are putting into researching and prepping and practicing. And really, when you think about the interview process, it's those two, it boils down and distills to those two processes. How well can you prepare for the interview? How well are you going to research the role, the position that you're applying to, the company you're applying to, the interviewers that you are going to be interviewing with? How well and how in depth can you research those things? And if you research those things, that's only half of the equation, because you're going to have to hop on that Zoom call, or you're going to have to go in person, or you're going to have to hop on a phone call, and you're going to have to convey that you know this information. Just because you know about the company, just because you know about the role, does not mean that you can communicate it effectively, articulately, and succinctly. You need to practice these things, and you need to do both of these avenues, the researching and the prepping and the practicing of the interview and your responses. You need to do that double or triple the amount of effort that somebody who's already in industry is going to have to put into it. That's up front. You need to know that. You've already seen this. When it comes to interviewing, network. Leverage your LinkedIn, send those DMs, make those connections, build those relationships, pick their brain about what the interview process was like for them to end up at pharmaceutical company, whatever. What was the interview process like? Who did you talk to first? How many stages were there? Were they one-on-one interviews? Were they virtual interviews? Did you ever have to go in person? Did you have to do a presentation as part of the interview? What types of questions were they asking you on the interview? All of these things, the answers are sitting in somebody else's brain, and all you have to do is just get them on the phone and ask them. There's no like secret conspiracy here. If you find somebody who's willing to give you the time and hopping on a call, they're going to be open to answering your questions. So network. Pick their brain about what the interview process was like. And again, based on your emotional intelligence, if you really feel like, hey, I found a real one, Jim or Janet, I really feel like I can talk to them, and I really feel like they care about, my transition into industry. If you feel that way, ask them if they'd be cool with doing a mock interview with you, and make sure they're going to give you honest, direct feedback. Sometimes it hurts, but it's going to make you better. All right. Interview tip number 3. When it comes to pharma, yes, it's important to know the role. It's important to know the company, their pipeline, what products are out there on the market. But when it comes to interviewing, pharma does love these behavioral, situational questions. And you can always tell what's a behavioral question with hey, Kathy, so tell me about a time when you had a conflict with a colleague. Or tell me about a time you had a conflict with your manager or your boss or your supervisor. And there's different derivations of it, right? Describe a time walk me through a situation where you had conflict with a peer. It's going to have derivations, but it's the same essence and core to it. They want to hear you tell a story. It's as simple as that. They want to hear a story, and they want to hear a story that fits this transferable soft skills that are going to be necessary for you to perform in that job. And so for these behavioral questions, think of these as a 3-act structure: beginning, middle, end. And you're going to hear about the STAR format, STAR. I found that even one step too complicated. So when I was preparing for my interviews, I use the STAR method because I do believe in a 3-act structure. So situation, action, result. And I also dug through the archives, and I found this table that I had created that I was using to help prepare me for my Otsuka interview back in 2018. And I had created this table fitting that 3-act structure. And you'll see on the table that I had these stories, these little mini vignettes that are based on like a theme or a prompt. So as you can see, I have a team conflict story. I have a thought leader collaboration story. I have a going above and beyond story. I have all these different stories. And so I wrote these, I crafted them, and then I practiced them. I would say them all the time. And I'd be driving in my car to go get groceries, and I'd be reciting some of these stories. And once you master the situation, action, result, you'll really find that it's second nature. You tell somebody, oh, this was the situation. I was a graduate student in my last year at Texas A&M, and my boss and I were trying to put together a big manuscript. Now, what happened was my boss wanted that manuscript to be one big, large publication, whereas I felt like that publication was going to be confusing and convoluted to the reader. So what I did is I set up a one-on-one meeting with my boss, and I asked them if they thought that the manuscript would be too confusing and too muddled for researchers to get the message. And then I proposed to my boss that we could actually break the manuscript up and separate it into two separate stories that make it clear. And then we would also double our publications. And so what ultimately happened is my manager agreed with me. And so we had published two manuscripts right before my dissertation defense in 2017. That is exactly what you're going to be doing for all these behavioral questions. The key here is that for the result, you're always ending on a high note. You're always riding off into the sunset. Interview tip number 4, this is going to be looking at emotional intelligence. Pharma is huge on trying to recruit people who are hungry to succeed, who are driven and ambitious in, being a team player. And they are big on trying to find people who can demonstrate emotional intelligence. And that is what is going to be happening when you are hopping on an interview. Doesn't matter if it's a phone call, a Zoom call, or in person. They are going to be looking for as many clues and hints as possible as to, does this person have proficient emotional intelligence? Are they self-aware? Do they know that they're talking too long? Do they know that they're kind of digressing and going into non-relevant territory? Are they aware socially that I'm getting bored or that I'm kind of losing interest because I asked them, tell me about yourself, and they're talking for 5 minutes and rambling at this point? These are all things that you're being assessed at whenever you're on the interview. So you have to demonstrate emotional intelligence. And the biggest things here are you are trying to convey on an interview that you are enthusiastic, that you are genuinely and passionately interested in the role and in the company, and that you are authentic. These hiring managers are doing more interviews than you can possibly fathom. At this point, it's safe to say that they can delineate who is somebody who is faking it and who is somebody who is genuinely excited at the opportunity to be talking to them and excited to really succeed in the role. And you want to be positive. All of your answers, you're going to try to cognitively reframe all of your answers so that they're positive. So if I'm asking Kathy, hey, Kathy, like, why are you interested in transitioning to this role? What is it about your old company that, is making you look for this? It's very important that you don't fall into that trap and start kind of denigrating your old company, because now you're painting the interview with a negative tone. You want to reframe and package your response in that situation to forward thinking. I'm looking for something with a lot more growth potential and something that's going to really push me to be my best, whatever. But you're not going to focus on, oh, I'm leaving because I'm burnt out, or I'm leaving because there's no mobility in my current company. You want to stay away from those things. Be positive, frame them in a way where the glass is half full. Last interviewing tip is ask awesome questions. This is going to come from how well prepared you are. And also, you can ask people you network with, what type of questions do you ask the interviewer? Now, the keys here are that you want awesome. What are awesome questions? They're questions that are thoughtful, thought-provoking. They're genuine. They are tailored to the individual. You're asking a question to the hiring manager. I'm going to have different questions for them than if I'm asking questions to the vice president of medical affairs. They're going to be completely different questions. And so you should have tailored questions. You should be given a list of people you're going to be interviewing with and what their role is or what their title is within the company. And these questions are very subtly, subtextually communicating how well you know the role and how well you know the industry. So lean on your network, lean on your connections to give you some good, tailored, thought-provoking questions. And just because I love y'all and I'm really appreciative for you having me on this, I'm giving you 3 ones that I use. These are questions that I have used and I will continue to use them. So you can see these there. I don't have to read them for the sake of time. The big last sort of takeaway message is if you're on an interview and they say, so Kathy, what questions do you have for me? And Kathy doesn't have any questions. I am telling you, they are going to assume that you are not interested and you are not engaged. So it is, for this one, I'm going to say this is not gray area. This is very black and white. You need awesome, thought-provoking questions. So work on those, prep those, get some feedback from some mentors and some connections that you network with. Last things, definitely send thank you emails. And I have a real easy, high-level guide for you about how to write a personalized thank you email. You thank them for their time. You make sure you customize that thank you email with a topic you had discussed during the interview. And then you always close it with how excited you are for the role and why, after all this, interviewing, that you really feel even more confident that this company, this position is right for you. Don't talk longer than 90 seconds. I'd be timing myself. I do time myself when I'm practicing for interviews. All of your responses, including tell me about yourself, should be less than 90 seconds. Over 90 seconds, you're talking way too long. Dress professionally. If it's a virtual interview, take it as seriously as an in-person interview. I'm going to tell you right now that, yeah, if it's a virtual interview, I could be wearing gym shorts under this. You're not going to be able to tell. But would I recommend that? And do I do that? Absolutely not, because I know that I'm wearing gym shorts. The interviewer may not know I'm wearing gym shorts, but my own psychology is aware of the fact that I'm wearing gym shorts, and that could hold me back. In my mind, it could hold me back. I want to feel powerful. I want to feel confident. So if I'm doing a virtual interview, even though you're not able to see what's south of, my waist here, I'm wearing my full suit. So take virtual interviews just as seriously as in-person interviews. And you can optimize your environment with a virtual interview. It's home field advantage, basically. If you have to present, don't read off your slides. Do not stare at them. You should be making eye contact, and learn to practice and make eye contact with your webcam, and do as many mock interviews as possible. That's pretty straightforward. And you're going to be able to do those with people that you've built good connections with and good mentors with. So with that, I think we've reached the end. I want to thank you for listening to me, ramble on about all these different tips for resumes and interviewing. So thank you, Northeastern University, IPhO. This is my contact information. LinkedIn, I'll admit, you can send me a request, but my LinkedIn is inundated. So yeah, most people interact with me on Instagram, but this is my number. This is my email address. I want to be a resource for you. All of you who are on this, you can always reach out and we'll always be able to find some time to help. So thank you.
Thanks so much, Dr. Moore. Thanks for taking the time to put together this presentation. It's definitely tips that we don't really get much in pharmacy school. So I really appreciate it. So we collected some questions from our members. If no one has any other burning questions, I'm just gonna go through them. Okay. So the first question, what questions have you been asked when interviewing candidates that impressed you?
So there have been a few that have really impressed me. Off the top of my head, there was one candidate that asked, so I'm working for a company and they asked, so what is something that you know now about your company that you wish you would have known before you joined? And I was like, wow, that is a good question. That's a thought-provoking question. And I've never heard that question asked by anybody else. So it's unique and it's thought-provoking. For any of you, I hate to reference it again, but for any of you who watches the Hot Ones, that show is so good because the interview questions are so thoughtful and well-researched. This one that I just gave you is an example of a question that is thought-provoking and it stands out. What's something that you know now about your company that you wish you would have known before you joined? That one was really good. Questions about, I wrote some more down and I'm blanking on them. How do you collaborate with other arms of the company? I like that question because it's kind of focused on collaborating and they want to see who you're going to be partnering with. Ask about onboarding. So if I were to get this position, what does the onboarding process look like? How long is it? What type of training will I be receiving to make sure that I'm teed up for success in the role? If I'm asking if they're not going to ask it for me, but sometimes I've heard on interviews that if it's somebody who's in a more higher level position, it'll be, what's something about the division of the company you're in that if you could wave your wand and change it instantly, what would it be? So getting at things about change, getting at things about collaboration, getting at things about challenges it's going to help you as a candidate because you're going to be learning about, this company. It may look beautiful and shiny on the outside, but it's a company. There's no such thing as a perfect company. Each one is going to have trade-offs, disadvantages, downsides, and there's going to be distinct advantages. So it's going to give you insight on what are the challenges if you were to join that company. So those are just a few, Kathy.
So our next question is, what is a question that trips up most candidates during an interview?
Honestly, tell me about yourself. Gets it off to a bad start. If you don't have, and it's something that should be a layup. This should be a slam dunk. Tell me about yourself. The problem is that people tend to talk too long on it. They tend to talk too long and it gets the whole interview off to a bad start. Because again, it shows emotional intelligence wise, you're not very self-aware. You've been monologuing for 5 minutes on a very open-ended question. And now I only have a couple minutes left to ask other more important questions that I'm trying to learn from about you. The tell me about yourself should be an elevator pitch and you should craft this thing. You should put on your writing cap and, really summon your inner Ernest Hemingway and make it concise and impactful. And don't just read and recite your resume. Don't just say, okay, well, yeah, I graduated from this college with this undergraduate degree in 2012. And then I went to Texas A&M and got my PhD in biochemistry. I researched molecular mechanisms of oxidative stress. You don't want to be doing that for a tell me about yourself. These are all creative writing exercises. Come up and craft a really compelling, less than 90-second elevator pitch about who you are and why you are perfect for this role, for this internship, for this fellowship. That is a good tell me about yourself. It's not too long and it gets right to the point of why you're the perfect candidate for it. Other questions that trip people up are the behavioral questions. Definitely do. If you're not well prepared and you say, oh, I can't really think of a time where I had to multitask and juggle different responsibilities. I'm drawing a blank, or I'm drawing a blank. I've gotten along great with everybody that I work with. I've never had a conflict. Those definitely, you lose some stock and equity with the interviewer. And then lastly, hypothetical questions. I'll admit, I ask these during my interviews when I'm interviewing a candidate. I'll ask them hypothetically, based on the role, this situation, what would you do? Just to see what their thought process is. And if you haven't researched the role well enough and in depth enough, then you're going to kind of be lost in the middle of the woods with no flashlight, and you're going to be trying to explain yourself out of that. So hypothetical questions, those can trip people up. Like, say you're meeting with a key opinion leader in psychiatry and they tell you that they love your company's medication, and you find out that they actually have never used your company's medication. So you actually find out that what they're lying to you whenever they meet with you. How would you approach that? So those things can trip people up, to answer your question.
As a follow-up, do you like prep for those hypothetical questions? Like, how would you go about that?
It's tough. It's tough to prep for them. The only thing that I can think of is be prepared for them, know that they exist. And it really emphasizes why it is so important for you to control the controllable and be a master of your own destiny by trying to learn every single nuance and intricacy of the job. There should be no stone left unturned. If it is on that job description and it's a task or a responsibility, you should be going down that list, and on your networking calls, these informational interviews, you should be asking, okay, I see for the medical science liaison role, it says develop relationships with key opinion leaders. Can you talk to me in depth about what that looks like realistically? How do you go about building relationships? What are some challenges you face in them? So you need to know the role inside and out. And only when you get to that level where you do know it inside and out, it's honestly your best armor against hypothetical questions, because hopefully you should have at least touched upon this, because the hypothetical question will be stemmed from some type of transferable skill that's in the role. So in that instance, there's a conflict, right? This person, this psychiatrist is telling me one thing, but their actions and their behavior is something completely different. So how do I handle that conflict? How do I handle any conflict? So that's how you would go about answering it. But yeah, you have to know the role inside and out. That's it.
That makes sense. Our next question is, what do many candidates put on their resume that's found unnecessary?
The skills section. Skill section, take it out. If no experience and no bulleted item, think about it this way: is experience and bulleted items the actual sort of clarifications for what you're doing? If none of those reinforce or are directly transferable to the role, get them off of your resume. It's fluff. It's taking up real estate. You only have so much space on your resume. Get it out of there. If it's not backing up why you are the right person for this job, if it doesn't add to that, get rid of it. I see somebody had their hand up.
Yeah, hey, Dr. Moore. Sorry, I didn't get to submit this question, but I kind of wanted to ask, I guess, more personal of a question. I'm originally from Houston, so I kind of wanted to ask, did you end up being based out of Austin just because it was coincidence, that's kind of the opportunity it took you there? Or were you okay, I want to, post up in Austin, I really like it, or I want to stay in Texas, or, cover the South? What was that kind of thought process like for where you wanted to be based out of?
Yeah, that's a good question. And what's your name, good sir?
Sebastian.
Sebastian, that's a great question. So for an MSL role, you're covering a territory. So I was open to relocating anywhere in the galaxy if it meant me getting my first MSL role. I would have been an MSL on Mars if they would have said your territory is Mars. So I was open to relocating, and fortunately, luck was in my favor. I found a hiring manager at Otsuka who was open to a candidate who didn't have prior MSL experience, didn't have any psychiatry experience, and didn't live in the territory. And that territory that I ended up covering for 2.5 years was the Pacific Northwest. So I got to live in Seattle for my first MSL gig. And like I said, I would have moved to Buffalo, Detroit, anywhere, like Kansas. I would have moved there if that would have been it. The reason I left Otsuka to go to Pharma was because personally, I loved Seattle, but Austin was a lot more my flavor. a lot more my flavor in terms of the city life.
Right.
So that's why I ended up going to Pharmacosmos, because then I get to cover, and I get to live in Austin, and I get to cover all those different surrounding areas. And then that's where I'm currently based out of. I don't have any intent on moving anytime soon.
Okay, I love that.
Thanks, Sebastian.
Appreciate it.
All right, Kathy, what else do you got for us?
Yeah. How would you recommend connecting with your networks? You mentioned that as one of the tips. What are some good questions or advice to ask them about?
So the advice is, again, polish up your LinkedIn, number one. Number two, start sending out direct messages. You can be strategic about this. You can be tactful by targeting people who have a PharmD, such as yourselves. So they're going to be able to empathize because they're in industry. Some of them have been in retail. Some of them have been in clinical pharmacy. So they can empathize, with your plight of wanting to get into industry. So reach out, be strategic about it. Target PharmDs who graduated from your program, alumni. And then beyond that, just target anybody who's in the position that you're looking for. So you're going to reach out to them. You're going to keep your direct message. You don't want to write a novella for your direct message. Keep it short. Introduce yourself, why you're reaching out to them. Hey, my name's Mike. I'm a recent biochemistry PhD graduate from Texas A&M. I am super interested in the medical science liaison role, and I would love to schedule a 15-minute phone call with you to discuss what it's like being an MSL at AstraZeneca. Let me know when works for you. My schedule's flexible. Thanks, Mike. Short, simple, sweet, to the point. And then how you build that network is, I never got any of this in school. And so this is what I love talking about. When it comes to networking, if somebody is being generous enough to set time aside to talk to you, number one, after you hang up the phone, within 24 hours, send them a thank you. Thank them for their time. They're not getting paid to talk to you. They're taking time out of their own day to answer your questions, to give you insight and perspective and context to these things that are obfuscated for you because you're not in industry. So thank them. Thank them for their time. Number two, in terms of giving value, I actually had this question from somebody I'm mentoring just the other day. They said, how can I give value to somebody who's taking time to do an informational interview for me? I feel helpless. I feel like there's nothing I can offer. I felt that same way. What I found when I was networking is, what you can do is you can find out, take notes about the person. So what are they passionate about? Do they like movies? Do they like sports? Are they science nerds? Do they like cooking and baking? If you're able to find these little breadcrumbs of personal sort of factoids about the person you're networking with, use that to keep the relationship going. So for example, if I'm talking to somebody and I'm doing an informational interview with them and they tell me that they're a movie buff and I could talk to this person about movies, to the cows come home. If I see that there's a new Christopher Nolan movie coming out, I'm going to text them the trailer to it or something, because I know they'd talk to me and I could hear in their voice, my emotional awareness could tell that they lit up when they started talking about movies. So I'm going to just send them a trailer to a Christopher Nolan movie. And that's how we're going to keep in touch. Another way is, if they're in pharma, then typically they're covering a therapeutic area. So say it's neurology or psychiatry or hematology oncology. What you should try to do is try to find out what disease state they're covering. And if you can then remember what disease state they're covering, and again, you can take notes, jot down notes. They're interested in major depressive disorder. If you come across a medical article or a recent hot off the press publication that's related to major depressive disorder, text it to them. Say, hey, Jim, hope you're doing well. I know that you're on top of everything, but I came across this article and immediately thought of you and just wanted to share it in case you hadn't seen it. Hope all's well. That's how you share value in a networking situation when you're pretty much extracting things from them. It's how you reciprocate and give value back. You thank them for their time and you find things that they're passionate about and information that could directly benefit their livelihood. And you text them these things. You just text them. That's how you maintain and build a network. So sorry, that's a long-winded answer, Kathy. That's a motif that you're seeing throughout this. I'm addicted to context.
No, it's good. Last one for the interview portion. What tips do you have for staying calm and confident during interviews for those that get nervous and easily?
Research and practice. Do more mock interviews. Do more mock interviews until you feel confident. Your answers are fine-tuned. You know exactly what notes to hit in your behavioral interviews. You know exactly what notes to hit in your tell me about yourself. Why do you want to join AstraZeneca? Sorry, I'm picking on AstraZeneca. For some reason, it's just in my forebrain. Why do you want to work for AstraZeneca? What do you know about the role that you're applying for? Why are you interested in transitioning to the role you're applying to? You're going to practice those. You're going to rehearse those. You're going to have good mentors that you've found, and you're going to hop on mock interviews, and you are going to do this, and you're going to practice it, and you're going to verbalize it until hopefully it prepares you for the actual interview because you've done it so much. You're almost to a point where you're desensitized to the pressure of looking into a camera and, doing your tell me about yourself, spiel. That I'm nervous on interviews. I am, but I've personally found that digging into the research and practicing and hopping on mock interviews and doing as many of them as humanly possible, it helps assuage my nervousness about the whole thing. And if you can, last tip, if you can, when you hop on the interview with whoever you're talking to, if you can make them laugh in a natural, organic way, that helps break the tension and ease you in. Also, at least from my perspective, every hiring manager that I have interviewed with, a good hiring manager, a hiring manager that really is somebody who is good at their job, they want to create an atmosphere for you where you are comfortable because they want to see the best possible version of you. So most stellar hiring managers are not going to be coming into it, disgruntled and with a chip on their shoulder, trying to make you look stupid. They're going to be trying to ease you into the conversation and ease you into the interview like you're slipping into a warm bath. So just know that that's the psychology of hiring managers. They want to see the best possible version of you. And so they're gonna want to just kind of ease the tension naturally. And the good ones will do it effortlessly. But if you can make them laugh just right off the start, and you can do it naturally, use that superpower because it is a superpower, being able to make people laugh.
That's a great last tip. I think we're on the 7 o'clock mark. So I'm just going to wrap it up real quick. Just thank you again, Dr. Moore, for taking the time to make this presentation and coming out this evening.